so knock knock.
Come in.
Alright, so I'm gonna close the door for privacy and wash my hands. Mr. Dubois, I am here to do a little bit of teaching. Is that okay?
Yes.
Okay, alright. So, you're taking morphine. Morphine is for severe pain. Some of the side effects of morphine are nausea, vomiting, constipation, and respiratory depression can occur. For constipation, like I said before, ambulating and increasing your fluid intake will help prevent that, and also it will help prevent blood clots and it'll thin out the mucus. For your wound, since you had a hip replacement, you want signs and symptoms of infection are like redness, warmth around the area, swelling, pain, fever can also occur. You may also see like yellowish, greenish discharge or even a foul smell. If you notice any of that, you want to make sure that you report those to the healthcare provider. Because you also have a wound, you want to increase your protein intake, and foods that are high in protein are like tuna, steak, chicken breast, salmon, Greek yogurt, cottage cheese, stuff like that are all pretty high in protein, so you want to make sure that you increase that to promote wound healing. Let me see, and okay, give me a little bit of teach back. Okay, alright, so for morphine, it can cause respiratory depression, it can also cause constipation, so I need to ambulate and I need to increase my fluid intake. I need to eat foods that are high in protein like tuna and eggs and cottage cheese. And if I notice yellowish or greenish discharge around my wound, or if it becomes too painful or swelling or red or warmth, those are all signs of infection that I need to report to the healthcare provider. Yes, exactly. Okay, alright. So I'm gonna get a quick set of vitals on you. And your temperature is 98.3. Your blood pressure is 125/68. Your heart rate 70. Your respirations are 20, and your O2 is 98% on room air. And I'm just gonna check your catheter, and it's about 500 ml. It's yellow and it's clear. Let me see. Mr. Dubois, after administering the morphine, how do you feel?
I feel better.
You feel better, okay. And on a scale of 1 to 10, how would you rate your pain?
1.
Okay, and does it radiate?
Does not.
Does not. What makes your pain better now?
The medication really helped. The Tylenol, I feel like, did the trick.
Okay. Okay, alright, so that's good. Okay, alright, so I am going to make sure that the bed is in the lowest position, the rails are up, your call light's within reach. Is there anything else I can do for you?
No, thank you.
Okay, alright, so I'm gonna open the door and wash my hands. Let me turn it off.